We now go to the president and CEO of the Mayo Clinic, Dr. Gianrico Farrugia. He joins us from their campus in Rochester, Minnesota. Good to have you with us, Doctor.
Thank you for having me on the show.
You may have just heard the governor of Louisiana tell us that his state is about to run out of ventilators. It's the one thing he says that keeps him up at night. And by April 10th, he doesn't expect to have enough hospital beds to accommodate the sick. Is this going to be the story across this country at hospitals?
Yes, this is a critical element of our conversation and discussion as a nation. We have to focus on saving lives. And saving lives means that we have to be very diligent about it because there is no direct end in sight. And therefore we have to continue to learn and improve as the wave of surges happens across our country. We have to really be diligent about focusing on what we can do to prevent people from getting sick, and if they're sick, how can we prevent them from entering into an ICU? And then once they get into an ICU, how can we make sure that their stay is as brief as possible? Because if, for example, you can go from 10 days on a ventilator to 5 days on a ventilator, then you can double the number of available ventilators. And Mayo Clinic, together with many other organizations, is laser focused on doing this, focusing on testing and focusing on novel therapies to be able to really flatten and bend that curve.
One of the therapies that's gotten a lot of attention is these antibody serums. Tell me what your thoughts are on how effective that can be.
So we know that in order to really handle this crisis, we have to take many different approaches. The best antiviral still remains washing your hands, and we have to remind people of that. Then there are the antivirals themselves that attack the virus themselves. Then there are agents that are effective at blocking the molecules that the virus causes our own cells to release. And that can prevent some of the damage we're seeing in the lungs and other organs, including the kidneys. And then there are these convalescent sera, or convalescent plasma, where you take plasma from a person who has had the virus and has recovered and has now an antibody response to it, and take that, and in general you can treat 4 people from 1 person. And doing so, you can provoke a given response that allows them to recover more quickly. This is based on other diseases. It is now being tried for the coronavirus, for COVID-19, and Mayo Clinic and other institutions are working very hard, collaborating with industry to make sure that we can have adequate supply to test if this is going to make a difference. And I'm hopeful that it will.
We've also heard from epidemiologists about the hope of contact tracing, basically figuring out who you've come in contact with in order to determine how at risk you are. How would something like that work in the United States?
So every country has a different threshold on privacy of information, on data, but certainly we as a country have plenty of technology to do better at tracing. We've been collaborating, for instance, with MIT on an app called Safe Paths, where you can opt in, and then within your network, you know if somebody within that network tested positive or even has symptoms. Then we're working with a company called Inference in Boston at really becoming better on predicting hotspots, because currently we're predicting hotspots very close to or even a little too late from when they start to occur. And if you have the ability to use artificial intelligence to in real time know when a test is positive, but also understand things like, okay, how many tests happened in the last 24, 48 hours, because that's really important. How many people are being admitted? You can get a much better idea of where the next hotspot is and then move resources. And in the last couple of days, we've tried that, we've done that within the state of Minnesota. And we believe that there are many of these innovations that are happening across the country that will help us improve the way we trace and the way we advise people to be able to, one, avoid getting sick, and once they get sick, to understand what we can do for their immediate contacts. And that is one of the very important ways that we can flatten that curve and at the same time inform the public, because as you know, fear is a big part of this current pandemic.
Well, based then on what you have seen so far, do you think that it is underestimated how much of this virus has already infected parts of the American Midwest?
There's been a lot of discussion about that. We have to be driven by the science, not by conjecture. I mean, we always have to be driven by the science. And to be driven by science, we need to have the right testing. And testing serology is going to be very important that way. to understand who has an antibody and therefore can be presumed to have had contact with the virus and has mounted a response to it. We at Mayo Clinic have spent a lot of time developing first a PCR test, now a serology test. There are many other institutions that are doing so. And this is where innovation and collaboration comes together, because there's no one single test that is the right test, and there are many different tests that can be used. Serology for what you stated, but also trying to bring the price down. For example, the Atomic Agency in Austria is trying to use isotopes to develop a very cheap test.
Okay.
University of Washington, UC Berkeley are using CRISPR to try a different test, as well as in New York. So what we're going to be seeing is a multitude of tests, and that multitude of tests is going to be able to give us the answer to that question.
We wish you good luck. Thank you very much, Doctor.
Well, thank you very much, and I really do want to thank every healthcare worker. Thank you.
We do too.